All right, welcome to The Explainer. Today, we are diving into a really incredible study that is already changing the game when it comes to managing one of the toughest parts of cancer treatment. For millions of people, this isn't just some academic question. It is a real, everyday struggle. The whole point of cancer treatment is, of course, to save your life, but that journey can be unbelievably harsh. So the question that researchers are always asking is, how can we make this whole process not just more effective, but honestly, more human?
So let's start with the big one, the problem at the heart of this. For a lot of people getting treatment for breast cancer, chemo brings along this really nasty sidekick. We're talking about severe nausea and vomiting.
And look, we're not just talking about feeling a little off. This condition, which doctors call CINV, can be completely overwhelming. It just crushes a person's quality of life. And it can get so bad that it actually makes people question whether they can continue with their life-saving treatment. It's that serious.
Now, doctors did have a pretty powerful weapon to fight this. But, as we were about to see, that weapon came with a major and pretty dangerous flaw.
So, the drug is called olanzapine. And for years, medical guidelines have recommended it because, well, it works like a charm against nausea. It was a huge step forward. But there was a big problem. And this right here is the heart of the dilemma. The standard 10 milligram dose, absolutely fantastic at stopping the nausea and vomiting, but the trade-off was huge. It caused major daytime drowsiness. And we're not just talking about feeling a bit tired. Most patients get chemo as outpatients, meaning they have to get home afterwards. Being dangerously groggy is a massive safety risk. You just can't have. So this challenge, how to get the benefit without the risk, is what pushed researchers to think outside the box. And it led them to ask a really clever question.
What if the problem wasn't the drug itself, but how it was being used? Instead of this one-size-fits-all sledgehammer approach, what if a little finesse could do the trick? This simple question became the basis for a totally groundbreaking clinical trial. The new plan was just beautifully simple. First, cut the dose in half, from 10 milligrams down to 5. And second, and this is the genius part, they've changed the timing. Instead of getting it at the hospital before chemo, patients would take it at home right before their evening meal. The thinking was, let's have the sleepiness kick in when you're already supposed to be sleeping. So smart. Okay, so before we jump into the results, we need to be really clear on what success even means here. The main goal, the absolute gold standard for the study, was something called a complete response. And that means for the full 5 days after chemo started, the patient had zero vomiting and didn't need any extra or rescue anti-nausea meds. That's the bar.
All right. So the plan was in place, we know the goal. It was time to put this new, smarter approach to the ultimate test in a big, serious clinical trial.
And this was no small test run. We're talking about a trial with 500 women with breast cancer across 15 different hospitals in Japan. It was a phase 3 double-blind, randomized, placebo-controlled trial. Now, that's a mouthful, but what it means is that this is the absolute most rigorous kind of study you can do in medicine. The results you get from this, they are rock solid.
And the results? Well, they were a knockout. Just look at this. You can see the huge difference. That bar on the left, the one showing patients on the new 5 milligram olanzapine plan, is just towering over the placebo group on the right. A massive improvement in the number of patients who got that complete response we talked about. So what this means is that this wasn't just a lucky break. You see that little p-value there? Less than 0.0001? In plain English, that means the odds of this result happening by pure chance are less than 1 in 10,000. It's about as definitive a win as you can get in science.
Okay, so it works. We've established that. But what about the whole reason we're here? The dangerous drowsiness. Did this new approach actually solve the safety problem?
And this is where the story gets even better. The safety data was just fantastic. Really bad drowsiness was super rare. Only 2% of patients in the olanzapine group felt it. But here's the totally unexpected bonus. Look at anorexia, the severe loss of appetite. Patients on the new plan had way less of it, only 13% compared to a whopping 38% in the placebo group. So not only was it safer, it actively helped with another major, miserable side effect.
So when you put it all together,
You have a treatment that works way better and is also safer? That's not just an interesting finding. That, my friends, is a new standard of care.
And hey, you don't have to take my word for it. The people who actually ran the study said it themselves. They concluded that their findings are a substantial advancement, and they give assurance that this 5 milligram dose is both safe and effective. That's the kind of strong, clear language that literally changes how medicine is practiced around the world.
And really, this is what it's all about. This isn't just about numbers and charts. It's about a real, tangible improvement in the lives of people going through one of the hardest fights imaginable. It means treatment is safer, it's more tolerable, which means people are more likely to stick with it. And that leads to better outcomes. And that just leaves us with this one last really fascinating thought. They didn't invent some new high-tech miracle drug here. They just took a tool they already had, and with a simple, incredibly smart tweak to the dose and the timing, they solved a huge problem. It really makes you wonder, doesn't it? How many other stubborn medical problems could we solve, not with some futuristic invention, but just by being a little bit smarter about how we use the tools we already have?